Dr. Gordon, welcome to the Health Path podcast. It's a real treat to be able to connect with you today.
Thank you, Alex. Same with you.
I didn't mention before I hit record actually, but I heard you speak in London earlier this year at the IPM Congress. So that was kind of my introduction to you and your work. But for those of our listeners that might not yet be aware of you and what you do and your background, are you happy just to share a little bit of an introduction?
Yeah, of course. So I am a medical doctor and I specialize in something called cannabis and integrative medicine, which most people have never heard of. And basically, what that means is I help people with tools using the cannabis plant or cannabinoid medicines, and I use those medications and those tools alongside things like medications, integrated medicine tools, functional medicine, and the whole integrated medicine toolkit from a very evidence-based perspective to help people reduce stress and burnout. I focus specifically on conditions related to fatigue, pain, and chronic fatigue syndrome related conditions, long COVID. So that's really the span of my work currently. How I got here was I became a medical doctor 15 years ago, was very interested in integrated medicine. No one really knew what it was. No one was using cannabis. I became a chronic pain patient. I had an accident with my hand, went on to use cannabis topically myself. And then I ended up adding it to my practice alongside drugs, herbs, meditation, the whole bit. And then I ended up treating thousands of patients with medical cannabis alongside my integrated medicine practice. And I was treating patients who had tried everything. They had tried every medication. They had been meditating for years and their conditions were just not really budging. So I really became an advocate for medical cannabis. And all other new tools in medicine like therapeutic psychedelics alongside medication and functional medicine testing, all the other things we have available to create a personalized medicine system for someone. And also, I'm a real advocate of all the things you can do at home. So even if you can't come to see someone, there are so many of these tools that you can do as self-care. And I'm really into people being empowered about their self-care to heal from a lot of these chronic symptoms. So that's really a bit about me.
Brilliant. I think that's amazing, like to have that breadth of training from a conventional, not just from a conventional and a integrated perspective, but then bring in sort of the cannabis, which is, at least from my perspective, quite a small industry, a small section of medical practice. Like to meet someone that does all of the things that you do is quite rare. So I'm really looking forward to picking your brain on quite a few of these things today. Obviously, you have your first book called the CBD Bible, which I have read parts of, and that's really, again, how I became aware of some of your initial work. But you have a new book coming out, which is all around resiliency, I think I'm right in saying. So,
Yes.
with that in mind, I guess a nice way to start might be to sort of unpick this concept of resiliency and resilience medicine. So, for you, what do you mean by this?
Yeah, so resilience medicine came into, I guess, conception. I mean, I've been doing this type of medicine for years, but when I used to try to explain to people what I did, what kind of medicine I did, it was usually this long-winded explanation. Well, first I was trained as a conventional medicine doctor, then I did an integrated medicine fellowship in the United States, and then I became a board certified integrated medicine specialist. Oh, and then I added cannabis. And at the end of the day, all of the tools that I use are really helping people become more resilient. And what I mean by that is not being tougher or grinding it out and having more grit, more mental grit, because that's a concept of resilience that is out there and that is interesting, but that's not what I really mean. It's more about helping people to bounce back or even bounce forward from the life and health adversities that we all face. And the best part about resilience, and this is what I love about this concept, is that you're never too fatigued, too sick, too old, to anything to become more resilient. So some of my most resilient patients have faced things like stage 4 cancer. Even someone who is terminally ill can become more resilient, can have a better quality of life, a better sense of well-being. And it can span, from that side of things to someone who has burnout and wants to recover from burnout syndrome. So resilience medicine is all the tools that we can use, and a lot of them are self-care tools. A lot of them you don't need to come to a doctor for. Some of them you do, like, prescribed medical cannabis, but a lot of them you don't. So it's really, the whole concept is empowering people, even in their self-care, to see what they can do to feel better, to have more energy, to have a better sense of well-being, to have less pain, better sleep, all these things that everyone wants, be happier, with the tools that they can use themselves, and then using them in a really specific way based on their resilience type. So there's, we're all different. All of us are different. We need slightly different things. So that's really the concept behind it. And that's what the new book, it's not out yet, is about. But I also have a blog about it, and people can take a free resilience assessment and see where they're at. And that's what I try to do with my patients, because at the end of the day, one of the downsides of Western medicine, there's so many great parts about it, but it doesn't empower people, and it kind of breaks things down into all these parts, but it doesn't really do a good job of putting them all together. And that's what is really the goal of what I try to do with people, and what I want people to be able to really, at least at some level, do for themselves, because it's possible.
Yeah. And I love the concept of resilience, not only for all the things you've mentioned there, but I always also feel that no matter what the diagnosis, whatever the label is, ultimately we're saying that someone's lost resilience in some shape or form, and we need to help them get their resilience back. And by focusing on that model, you kind of, it almost simplifies things, I think, to a degree. And you can break it down into, what's someone's psychological resilience, physical resilience, emotional resilience. You've got so many different strings that you can pull on. So it's a beautiful model from that perspective as well. So with all of that in mind, I guess, how would you say that cannabis fits into this? You mentioned that you work a lot with chronic fatigue syndrome and pain. Our customers and our audience are often either struggling with these sorts of conditions, CFS, fibromyalgia, and also a lot of gut-related conditions. And a lot of our practitioners listening are working with a lot of clients with these sorts of conditions. So I'd love to be able to kind of see how this interconnects.
Yes. So this is a really good segue into cannabis medicine. So cannabis is one of my best tools for resilience. And the reason why, at the core of it, is we have a system in our brains and our bodies that can utilize the plant compounds from the cannabis plant called cannabinoids. And this system is called the inside of us, endocannabinoid system. And we didn't know about this system when I was in medical school 15, 20 years ago. We only really learned about it more recently, even though the evidence was there for it, but it wasn't kind of sifting down into the medical curriculum. Even now, we've just started to teach it at medical school. And why it's so brilliant is this system is actually the control, the balance system in our brains and our bodies. So it helps with this concept called homeostasis, or brain and body total balance, which obviously is resilience. So if a brain and body are more resilient, they can go back into balance when things get out of whack, before things have gone to so out of balance that you need to really bring in the hammers and the big guns. So that's what this system in our brains and our body does, this endocannabinoid system. But just like any other system, sometimes it needs help. And the plant compounds from the cannabis plant, the cannabinoids, the THC and the CBD, they work on this system in the brain and the body to help regulate, to help us bring balance back. And it doesn't, cannabis doesn't cure chronic conditions like fibromyalgia and chronic fatigue syndrome, but it's an incredible quality of life tool that can help bring us back into balance and help reduce the symptoms of the fatigue and the pain, so that the nervous system is in a calmer, more regulated state. And then people can start to benefit even more from the other things we can do. So, the functional medicine things, we do the gut repair, all the things that we can do in the realm of functional medicine can work better once the nervous system is in a calmer, more regulated state. Because if we're in this fight or flight mode all the time, it's really hard to do things like mindfulness meditation. Even to follow a gut restoration program is very difficult for people, because the eating behaviors, the foods that they're eating, that they're craving, that they really need to stop, at least temporarily, they just can't do it because the brain is just so dysregulated. So cannabis is one of the best resilience medicines I have available. And that's one of the reasons why I utilize it so much in my practice, from from conditions ranging from chronic fatigue syndrome and long COVID to fibromyalgia, central sensitivity syndrome, complex regional pain syndrome, all these conditions, PTSD, which is vastly under-recognized in people with chronic illness. Cannabis medicines are very effective for PTSD symptoms to help us, again, be able to bring that balance back into the middle, and then we can start doing all the other things, and it works better. We get more and more regulated versus more and more dysregulated.
Right. Okay. That's really interesting. And I would love to try and sort of dispel some of the myths and sort of maybe the misconceptions around this, because you hear a lot of concerns around cannabis, medical cannabis. People don't necessarily fully understand how it's used. I think sometimes people just imagine someone smoking a spliff on the couch, and that's kind of medical cannabis. But you set the scene, I think, really well in your book. And I think I remember you pointing out some paintings in Japan or a Japanese island from like potentially 10,000 years ago, suggesting that this plant is something we've used and evolved with over thousands of years. And there's a long history of its use for lots of different reasons as well. So are you happy just to share a little bit about what this looks like when used sort of from a medical perspective?
Yes, of course. So you're right. So this is a plant that's been used medicinally and for spiritual purposes for thousands of years in many old world cultures, ancient China, India, the Sumatra, the Akkadians, the Egyptians. There's many cultures that have used this plant. So as far as the myths about cannabis, one of them is that we're going to make all of our patients stoned or feel high all day, and of course, it's just not the case. We're using medical cannabis, which is different than smoking a joint in terms of how we're delivering the medicine. So with medical cannabis, obviously we don't want patients to smoke it. We deliver it via mouth, an oil, or vaporized. So it's a low temperature, non-smoked substance. And the quantities are very different, the amounts that we give people. So for example, we're not giving people really high THC products with no CBD at very high doses, especially if they're naive, because that can make someone feel impaired. And at too high of a dose, THC can just have the impairment feelings and make people feel, it can really worsen anxiety and mood. But at small medicinal or even microdoses, THC combined with CBD and these whole plant extracts, the medical ones that we use, can actually help bring more balance into this endocannabinoid system. Versus if it's really high THC and there's no CBD, this is a generalization, but generally this is how it works, then you can actually unbalance the endocannabinoid system further. So it's done in a really specific way when we use medical cannabis. But medical cannabis in general is very safe. People cannot die from an overdose of medical cannabis like they can from opioids. It has a low potential for addiction, when it's used medicinally, like we've discussed. Much lower potential for addiction and habituation than many of the other first-line medications that we're supposed to use for, chronic pain, for example. So how it works in the body and the brain is actually dose dependent, and it depends on the type of medical cannabis product that we use. So there's THC, which is the chemical everyone knows that makes you feel high. But THC is also very good for people with gut symptoms, spasm in the GI system, a lot of the autonomic nervous system dysautonomia problems that a lot of our patients with chronic fatigue experience and chronic pain. And it's also really good for relaxing the muscles, helping promote sleep when sleep is dysfunctional. And at very small doses combined with a lot of CBD, it can also be very good for anxiety. And THC can also be useful for PTSD. So those are kind of all the ways that we can utilize the full plant spectrum oils, which are different than the over-the-counter CBD oils from hemp, those don't contain THC in any measurable amount. So those can still be helpful for some people for stress and more, milder symptoms. But I always tell people that even if you've tried a hemp CBD oil and it hasn't done anything for you, it's very likely that there's a medical cannabis product that could still be helpful for you, because it's the THC component that we often need for the more severe end of the spectrum of symptoms.
Okay.
Yeah.
Really interesting and good to know. And I think, there are hundreds of chemicals or plant compounds in the cannabis plant. So am I right in saying that there's still potential that there's lots that we could learn about some of these other compounds as well, and sort of the properties that might be associated with them?
Absolutely. So there's a lot of research now isolating these different compounds and saying, okay, what if we just give someone CBD on its own, or CBN on its own, or CBG? And that's all really interesting. And for example, CBG, we think now has anti-anxiety effects. It has infective effects, so we can use it potentially for infections. But we don't really have the dosages yet for the CBG on its own that we would know that would say, be good for an anti-infective. So we can't use it for that yet on its own as first line. But we know when we combine strains of cannabis, medical cannabis, that are high in CBG or CBN or some of these other minor compounds, that we get a more specific effect. So we might want to use high CBG cultivars for someone with anxiety and pain, or we might want to use a product higher in something called CBN, which is this THC breakdown product, in someone who wants kind of a more calming, pain relieving effect, but without the potency of THC. So all of these compounds are being studied individually, but still what we see when we use them clinically in the clinic with patients is that when you use them together, you get this nice synergy effect. And it's greater than if you just use an isolate of this, an isolate of that. And that's one of the reasons why CBD isolate, there's a few medications that are just CBD by itself. And even for children with epilepsy, they don't work as well as the full plant extracts. And that research is really becoming more and more obvious in the epilepsy research. So, it's back to a general principle of botanical medicine, that you use multiple plant compounds together in synergy, specific combinations, rather than just using, say, valerian root for sleep. By itself, valerian root for sleep isn't very effective, and it often takes 6 weeks to take effect. But when you combine it with other things, it can be more effective. And cannabis is the same thing, but it's all in one plant.
Huh, okay. And this might be a really simple question, but you've mentioned there sort of the concept of different strains of the cannabis plants. Would I be right in saying there are different natural strains and then sort of artificially created ones that are kind of higher in THC for those that are wanting, a potent get stoned strain, so to speak?
Yeah, that's a great question. So strains, the technical word for them is cultivars or chemovars, which means the specific breakdown of not just the CBD and the THC in that plant, but the hundreds of other plant chemicals. So the minor cannabinoids, like the CBN, the CBG, CBDA, all those things, and then we have the terpenes, which is another the smelly parts of the plant, the ones that make the plant, the aroma of the plant. So all of those different compounds form a cultivar or a strain, and there used to be not as many natural strains. There used to be what we used to think of maybe 40 years ago as an indica strain, which is generally thought of as a very calming, relaxing strain, and then a more uplifting, energizing strain, which is called back then a sativa. We still use those terms, but now we've used modern genetics to interbreed those strains, and we've created thousands of strains that are more specific to the effect that someone would want to have. And this actually started with the black market. There was black market cultivators who were expert herbalists and expert growers, and they were doing this over the years, way before it became legal. So a lot of these experts have now been recruited by cannabis companies, legal cannabis companies, to help them after everything became legalized. So there's most of the modern strains we have, really all of the modern strains have all been cultivated specifically and bred using modern genetics to get a specific strain effect.
Okay. And is there concern around some of the kind of the higher THC strains that have come into existence?
Yeah, well, it's another good question because, let's say 40 years ago, again, what you were getting on the black market might have been 6%, 4 to 6% THC, maybe 7% if you were lucky. And that's not going to make you feel as high, and it's going to have more of that natural CBD. So CBD, when you have it with THC, this is an oversimplification, but generally speaking, it tends to buffer THC side effects. So you can get the medicinal effect of THC without the side effects of feeling high or intoxicated or feeling lethargic or stoned or sleepy. And what we found over the years is because the breeding came from the black market, is people wanted to get higher quicker. So on the black market, you have these really high THC strains. Now, sometimes we still use those high THC strains medicinally, but we use them in very small quantities, and we use them alongside a higher CBD product as well, generally speaking. So if someone, goes out and smokes, let's say, two huge joints, maybe they get 100 or 200 milligrams of THC into their bloodstream very quickly, that will generally, if someone's not used to it, make someone feel very high, intoxicated. It could make someone have palpitations or feel very anxious or even have a panic attack. But if we use the same strain, even in its small amount for someone who has chronic pain and chronic fatigue and sleep disruption, you can completely change their symptoms and change their life by making them feel normal, or almost normal again. So they can go and they can live a fuller life. So it's really it's how we utilize these plants. And cannabis is a power plant. These are powerful substances, but just like many other things in botanical medicine and in Western medicine, if you utilize them properly, they're medicines. If you utilize them, irresponsibly, then they can do harm.
Okay, brilliant. Thank you for that. And I'm wondering, unless there's anything else that you'd like to add around the cannabis side of things, whether we kind of move back into this concept of resiliency, because you've mentioned obviously that this is one of the tools within your toolkit, but there are numerous other things that can be considered. So I'm wondering whether we could either pick a condition, or whether we can keep it even more general than that, and kind of just start to touch on what are some of the other tools that you see as being powerful, significant, that someone could consider if they're dealing with a chronic complex issue.
Yeah, definitely. So I think, chronic fatigue spectrum illness, which is what I call this bucket of conditions, because as you probably know, as probably a lot of our listeners know today, chronic fatigue syndrome is a bucket diagnosis, but there can be many different types of chronic fatigue syndrome. So someone could have a pain trigger, someone could have an infectious trigger, someone like long COVID, for example, is really a form of chronic fatigue in many cases, at least in a subset of patients that I see. So what I usually do is I start with, when patients come to see me, they often come to see me trying a lot of things already. So oftentimes they've already tried a lot of conventional medications, ranging from antidepressants to sleeping medications to pain medications. Oftentimes they've already been to see a naturopath even, or they've tried meditation. So cannabis is actually one of the first ones I start with because it's so powerful. Because what I find is, unless we get the nervous system dysregulation under control and get people feeling a bit better, the brain has no capacity for anything else, because it's using so much energy just trying to cope with activities of daily life. My chronic fatigue and chronic pain patients, it could take them 3 hours to get going in the morning when they first come to see me. So that's why I usually do start with something like often medical cannabis. And in the UK, since we're in the UK, this is a prescribed medication. So you have to go see a doctor who specializes in this type of medicine, and then you get a prescription. And it's different from the hemp CBD products you see over the counter. So that's usually where I start with people. And usually I'll start with the medical cannabis, plan with them. We'll get them on a really specific few products that I think might help them during the daytime with their fatigue and their brain fog. And then at nighttime, helping to kind of start to reset those sleep cycles. Then once we get them feeling a bit better, then we usually do what I call the sleep reset program, which involves some supplements. Sometimes I do some functional medicine testing, like, looking at their stress hormone levels and their melatonin, their sleep hormone levels. And then we try to get their sleep on track. And then we start working on the daytime symptoms. And that can include, sometimes we start with the gut. Oftentimes we start with the gut. So again, sometimes that includes functional medicine testing, supplements, dietary change, and also a mind-body component. So, helping people really tap into that mind-body connection, starting with something really simple, like a 1-minute relaxation practice that they do a few times during the day to kind of reset the nervous system arousal levels. All of these things help, but we do it over a course of many months, because if you do too many things at once, people just get overwhelmed. And what I find with my patients who are the sickest is they've actually tried the most things. They've tried the hardest to get better. And it's so frustrating because they just feel like it's really not fair. Like they have to eat perfectly, you have to do everything perfectly, and they're still having symptoms. So that's where I found the cannabis really, really helpful. We can get them, instead of an 8 out of 10 for all their symptoms, we get them down to a 5 out of 10. And then at a 5 out of 10, then we can do so many other things, and they can stick to an eating plan better. They can remember to take supplements. They can have more, sometimes they can go back to work, so they can afford some of the more, the fancier functional medicine testing panels. Like all of these things start to happen in their life.
Amazing. It sounds like, well, that nervous system dysregulation that you mentioned earlier is such a foundational part to this. And B, it reminds me of, sometimes people need stabilizers put on, so that, as you say, to be able to then actually go and follow through with some of the things that we need them to do to get better.
Yeah.
So that's your experience with sort of medical cannabis here.
Absolutely. I had patients who were just really stuck. I see a lot of patients who have been stuck for a long time, and then sometimes they get unstuck, but in the last few years, they got unstuck. They started doing all the good things, and then they got COVID. And, we know people who have had chronic fatigue spectrum illness before, or they've had a chronic infection in the gut, or they've had something going on before. When they get COVID, they seem to relapse. And, their mitochondria, or the energy powerhouses in the cells, they might still not be working properly. And there's often a genetic component. So it's often, some of this is also removing guilt and shame. Like, some people are just genetically prone to these conditions. And it's not their fault. It's not that they've done anything wrong. It's not that they haven't been good enough. And it's kind of helping them see it through that lens. And then, like you said, getting the stabilizers on, getting them back on track, and then trying to keep them on that higher level of function, so they can continue with those things that we know are good. Because, as we know, unfortunately, if you go back to eating a poor diet, or you go back to not meditating at all, then over time the brain and the body lose those benefits. So it's something, we do have to keep up. It's sort of like exercise, the same thing with exercise. But if you're feeling so bad and so fatigued and so much in pain, you can't get out of bed, we got to get you better first so you can do those things.
Right. Yeah. And that point around there's a potential for a genetic predisposition with some of these things, I think is a really important one, because the word that comes up for me there is kind of self-compassion. Ultimately, as you say, if you can change that lens, that perspective that you're seeing your health journey with, then that's really powerful ultimately.
Yeah, that is medicine in itself. I think, some of those tests, they might not change. They don't often change what I do clinically. Very few times they change what I do clinically, but it's the removing the guilt and the shame and introducing that level of self-compassion. That is very healing. And that's often worth the money to spend on a functional medicine test for many of my patients, to just know, okay, it's not my fault. It's just, and it's not to say there's nothing you can do about it, because there is, but everyone has their own starting point. Everyone has their own resilience threshold that they start from. So if you start from, a predisposition to fatigue and to anxiety, and you just get to a baseline where you're able to, find happiness and calm your nervous system down, you might never be a naturally really calm and energized person in the same way that someone who's born with different genetics is, and they can just eat bad food and go out all night and do all the bad things and just wake up perky. You might never be able to do that, but that's okay. And just having that self-compassion, knowing that, you know what, I do need, I mean, I'm one of these people, I need more sleep than average. I can't tolerate a lot of alcohol because it makes me feel fatigued and awful. So I've just accepted these things about myself over the years. And that acceptance is a really big part of, I think, the healing journey for people.
Yeah. And if you think of resiliency being, well, resilience is about being able to, in some ways, bear the strain and navigate our path. That's one way of looking at it. And the more compassion we can have and the more an understanding and acceptance we can have, the lighter the loads that we're putting on ourselves, I guess. It's another way of thinking about it.
Absolutely. And, that's another reason I love the mind body practices, the group of practices, because they can be free. And, I always say, start with the things that are free and easy. So, and I have to combine them with medical cannabis. So I'll often combine a short relaxation practice or a guided recording with the medical cannabis. Because sometimes people, they need to do the mind body practice, but the nervous system is so ramped up that they can't actually physically and mentally relax the nervous system without some help. So I find when you combine the two together, then it's just getting the whole brain and body into this nice relaxed state. And then they can do something like even an easy self-compassion meditation where you just send yourself love and compassion. It sounds cheesy, but we have brain MRI studies showing that it actually can change our brains and help with relieve symptoms of depression, even if that depression is caused by chronic fatigue or by chronic pain. So I think, introducing these tools together is so powerful, and things that people can do at home.
Yeah, definitely. And I guess with all of what you're sharing there, I'm wondering whether clinically you have noticed any correlations between sort of adverse childhood events and trauma and some of these sorts of conditions that you see clinically, and whether, I guess, even just through experience, whether there's anything from a medical cannabis perspective and sort of early trauma and whether there's therapeutic potential there.
I think definitely. I think that more people are becoming trauma aware, but a lot of medical doctors are not trauma informed or trauma aware. And the thing about trauma is it doesn't have to mean that you were physically beaten as a child or that something really terrible happened to you. It can be, an emotional trauma that the nervous system and the brain perceived as traumatic. And it's different for everyone. Everyone responds to a traumatic experience differently. And then you have people who have repeated traumas throughout their life. And that's can sometimes lead to something called complex PTSD. And all of these things, of course, predispose then the brain, the nervous system, the immune system to becoming more vulnerable. Because the immune system is actually really, really closely linked to our nervous system, our stress system, to our energy production system. So there's a whole realm of medicine called psychoneuroimmunology, which is basically the nervous system, the gut, the immune system, all talk to each other. So I would say that my patients who suffer from these complex conditions, yes, more, I would say it's almost the exception not to have something in the background that we can trace back to, an early stressor or, something in childhood. And sometimes that is subtle. Sometimes they've had what's, quote unquote, normal, a lot of times normal childhood experiences, but there might have been an emotional undertone in the household, or there might have been something that happened to them when they were little that they didn't think really made a difference, or they might have been born premature and were on a ventilator there's all kinds of things that might contribute. So cannabis can help in terms of PTSD symptoms as an adult. And then we also sometimes in these cases add on things like ketamine assisted psychotherapy, so therapeutic psychedelics to shift the nervous system as well. And there's a lot of potential for using therapeutic psychedelics and cannabis together, which is what I get really excited about for the people who really need to get that shift.
Wow. So there's a potential for medical cannabis and something like ketamine assisted psychotherapy. Wow.
Yes. So we've used that in some of our more difficult to treat patients together. And oftentimes it's very effective. And it's people who have been stuck. And I also have a lot of patients who have not been able to access ketamine assisted psychotherapy because it's so expensive. And they've gone on their own and shared with me their journeys with things like ayahuasca and psilocybin done in a retreat setting often. Like you can go to the Netherlands and do a legal retreat now with psilocybin assisted therapy. Although it's not technically medical treatment there, it's, for personal development. I also have patients who microdose with psilocybin, and they get it illegally, but from someone who is using it for medicinal purposes, and they share their journeys with me, and those things have really helped them when Western medicine has not really been able to shift things for them. So I think now that these things are becoming more studied and hopefully more legally available, psilocybin is in the research phase now, but soon I think it will become clinically available. And it's a fantastic tool under medical guidance for some of these complex conditions.
Amazing. I wasn't aware that it could sort of be done alongside, so to speak. So that's really interesting. And it ceases to amaze me how these things have been outlawed. Just these natural plants or fungi that were made illegal and put on, well, certainly psilocybin, sort of a scheduled 1 drug.
Yeah,
just baffling.
It is baffling to me. And I had to, one of the reasons I was trained in conventional medicine and in botanical medicine. I was using all of these botanicals alongside drugs. I was teaching people how to meditate for years in my medical practice before I added medical cannabis officially. And the reason was because I'd been basically brainwashed in medical school and growing up in the Southern United States with the war on drugs that cannabis was going to send everyone crazy and mad. And it was a very dangerous drug of abuse. And I had to go on a journey, a scientific journey, because that's what it is. It's because a lot of, that was not scientific knowledge. That was really moralistically and politically influenced knowledge. So pulling apart what was the scientific parts behind the cannabis plant. And, it is, there are risks with cannabis, with anything, there is risk. But the risks have been vastly blown out of proportion. Even the risk of psychosis in cannabis, it's a very complex relationship between psychosis and cannabis, but it's not a direct one as many people think. And the risk is actually very low for most people. And the same thing with the psychedelics. Psilocybin carries almost, really no risk of addiction whatsoever. So unlike many medications we prescribe, but because it leads to an altered state of consciousness, we're very scared of these types of substances as a culture because they've been banned for so long. So people are very comfortable having a few drinks and getting drunk because you're used to that feeling. But anything that changes our perception, vastly, people are scared. Doctors are scared of these things. So the way forward is education, research, and we're finally getting there. Thank goodness.
Yeah, absolutely. And I think I always sort of jokingly say now that I think certainly us Brits culturally, we find just emotions uncomfortable, let alone an altered state of consciousness. So we've got a long way to go there. But I think David Nutt has done a lot around exposing the safety profiles of some of these drugs such as cannabis or psilocybin, LSD. And I remember a graph that he, in one of his papers, that really kind of gave a great visual to that, looking at alcohol and tobacco as being kind of the most problematic, I think it was.
That's right. And I share his feelings exactly. And you're right, psilocybin, when we use it, you can use psilocybin in research studies, and in the US, they're starting to use it clinically, and in Canada as well for treatment-resistant depression. What you see is, you have to combine it with psychotherapy, because psilocybin, it increases, it kind of ramps up our emotions. It makes us it makes things more accessible. And that's where, when things come up, and you can work through the therapy a lot quicker. So maybe it would take you 10 years of therapy, but maybe with psilocybin assisted therapy, you might be able to do it in a matter of months. Versus the SSRIs, which we use for depression and anxiety as, first line, a lot of people don't respond to them. And those medications, although they can be useful in acute situations where someone is unsafe or really panicked, for short-term use, they actually dampen down all the emotions. So it's almost the opposite mechanism as we see with psilocybin. So we think that, in the right context, with assisted therapy, psilocybin may have the potential to kind of dig deeper and get to some of the root of those symptoms. And then people hopefully won't have to take something every day. So that is kind of the hope for this field currently.
Yeah, fantastic. Brilliant. And is there anything else that you would like to share, Dr. Gordon? We've kind of touched on quite a lot, I feel, today, and you've mentioned lots of different tools within our toolkit that I think it's brilliant that so many of them are just accessible to us. Things like self-compassion, meditations, so much of that kind of self-care that we can bring in as a way to bolster our resiliency. But I'm wondering if there's something that you would like to kind of lead the conversation in that we haven't yet touched on.
Well, I think it's all about bringing these tools together and finding what are the best set of tools for each person. So I think one of my messages is always start just with one thing, because you can start working with one thing at a time and then add things rather than starting to try to change your diet. Like a lot of my patients try to do everything at once. They try to change their diet, start all their supplements, start exercising. Just be gentle with yourself, one thing at a time. And I have created a toolkit. If you go to resilience.clinic, people can take a resilience assessment. They can get, based on their resilience type, a plan to get started, because oftentimes it's just knowing where to start. So, and I'm going to be adding more things like meditations, resources, and things over time there. So I guess that's really it, is if those are hopefully some resources to help people if they're looking for some help on how to get started, because getting started is the hardest part, I find, for this whole journey. It's removing the overwhelm, I think, is the hardest part. So starting simple, starting small, even if it's 5 minutes a day of mindfulness meditation or a guided meditation, or it's trying a hemp CBD product, or just pick one thing at a time, removing gluten from your diet, and do it for a good 8 weeks and just be really patient.
Yeah, I think that's an incredibly good tip. And I think we can be guilty of that as practitioners, definitely in the UK, sort of recommending a whole program, sending our client off to go and do it and having a catch up in maybe a few weeks' time. So if you're listening, struggling with any of these conditions, I think that's a really great tip. So Dr. Gordon, thank you so much. It's been a real pleasure speaking with you around these different topics.
Thank you.
Do you know when the book is going to be out?
Yes. So the Resilience Blueprint will be out in April of next year, in the spring.
Okay, perfect.
Yeah.
And your current book, the CBD Bible, I will share links to that in the show notes as well. So guys, if you want to check that out,
Thank you.
what we've been discussing today around medical cannabis, having read most of it myself now, it is a really great book that goes into everything, I guess, from the history, the cultural use, to the different plant chemicals that we're aware of, and sort of chapters on different conditions as well. So it's a really great resource from that perspective. Dr. Gordon, thank you so much. It's been a real pleasure, and hopefully we'll connect in the future in some shape or form.
Thank you, Alex. It's been so nice to talk to you.